Mr. Speaker, for over 6 years I've championed the implementation in Manitoba of Jordan's principle that the child's needs come first and jurisdictional battles later. The principle is named for Jordan River Anderson from Norway House Cree Nation, who suffered for years in hospital and away from home while this government bickered with the federal government over who would pay for items like a showerhead. He died, never having a chance to go home. Now, after Liberals put on a lot of pressure in a 3-year campaign, the NDP government finally signed an MOU with the federal government in 2008, and yet the working group has sat for 4 years with no delivery of a public policy, nor properly involving First Nations in the interpretation of Jordan's principle. I asked the Premier why he's been so ineffective in implementing Jordan's principle, helping kids in crisis in Manitoba.
Thank you, Mr. Speaker, and I thank the member from River Heights for the question. Our officials do work in the spirit of Jordan's principle. He is correct. There are still ongoing meetings with the federal government to clarify the joint roles of the two jurisdictions with respect to people impacted in Manitoba, but where a case arises and a need needs to be fulfilled, our officials will act in the spirit of Jordan's principle and then work with the federal government on any necessary recoveries.
Mr. Speaker, the NDP's plan to implement on a case-by-case approach in regard to these children has clearly been shown to be another way of governments to pass the buck and stall decision-making. The problems in Manitoba continue, as we see from the human rights complaint filed by Harriet Sumner Pruden, who isn't getting prompt and fair treatment in respect to her 9-year-old disabled son, Dewey. Harriet pleads that governing bodies shouldn't deprive on-reserve First Nation children with disabilities of equal rights and opportunities in their policies and programs. I ask the Premier, who says he supports Jordan's principle, will his government be supporting the Prudence Sumner's human rights complaint, which has been brought forward to the Manitoba Human Rights Commission and to the Canadian Human Rights Commission?
Mr. Speaker, just to put some information on the record from Sheila Fraser, the former Auditor General of the 12th, 2009, with respect to Jordan's principle and its application in Manitoba, she said, "We've been very actively involved with Health Canada and the provinces, particularly Manitoba, where this has come up, and we have active case management. Kids are being dealt with, and the principle is being applied." There's still work with the federal government to discuss the financial side of it, but even the Auditor General of Canada has affirmed as early as 2009 that in Manitoba we do act in the spirit of Jordan's principle. So I want the member to know that we don't put kids at risk because the federal government hasn't agreed to pay part of the costs. We act in the spirit of Jordan's principle. We still look for a solid agreement with the federal government. The Assembly of Manitoba Chiefs is working with us on case conferencing. We're doing things on the ground to protect children. We expect the federal government will come forward and be supportive, just like they're going to do on the flood.
Mr. Speaker, now in 2012, 3 years after 2009, an article by Dr. Noni MacDonald in the Canadian Medical Association Journal has exposed the empty words of the Premier when it comes to Jordan's principle. The Canadian Pediatric Society has put the NDP government at no better than fair in implementing Jordan's principle, and Dr. MacDonald has said that the Manitoba government is merely paying lip service to a politically correct idea. Many see the Premier's lack of action as shameful, since Manitoba is the homeland of Jordan Anderson. Dr. MacDonald says the Manitoba government does not have a strong and effective implementation plan, and I ask the Premier, when will he put in place a cohesive and effective implementation plan for Jordan's principle that's reflective of what First Nation children and families are pleading for?
Mr. Speaker, I actually do appreciate the question because it raises important issues of how we provide services to First Nations families and children. In the case of dialysis, we've gone ahead and built dialysis treatment centers in First Nations communities without waiting for the federal government to come forward. In the case of prenatal benefits for young pregnant mothers, we provide benefits without waiting for the federal government to participate in that. We do that with respect to child welfare cases and other health-related matters. We, on the ground, operate in the spirit of Jordan's principle. We continue to work with the Assembly of Manitoba Chiefs, which have agreed to a case conferencing approach. We continue to work with the federal government to see their participation in clear rules on how finances are arranged to cover the cost of cases where services are provided through the provincial hospice and agencies related to the province. But we do act in the spirit of Jordan's principle. It is important that we get an agreement. It would help not only Manitoba, but First Nations children all across the country.